Hi, my name is Muaad Hussien, and I'm a final year medical student at Karolinska Institutet in Stockholm, Sweden, and our study focuses on surgical headlights in low-resource settings. The title of our study is Pilot Testing of a Fit-for-Purpose Surgical Headlight in Ethiopia. Introduction. Surgical lighting is poor in many low and middle-income countries. It's estimated that 24 million patients are at risk due to inadequate or unreliable lighting every year across the low and middle-income countries. Surgical headlights, however, are not widely available, mainly due to cost, for example, maintenance, and other logistical issues. The goal of our study was to understand the user needs of a surgical headlight for use in low-resource settings. The headlight was pre-selected based on a previous study, and the headlight is shown here in this picture. It's a technical headlight, commercially available, and not specific for surgery. However, it's used by different professionals, tradesmen, and athletes. Here, on the other hand, is an operation room that is of low resource settings. So you could notice that there is no surgical overhead light, and the electrical light is mainly just few bulbs on the ceiling. These bulbs are most of the time malfunctional. And even if they were functional, electrical outages are or could be commonplace. In this operation room, this natural sunlight is the main source of light, and that's a big problem across the world. Methods. This was a mixed design study. We had 10 surgeons that were given the headlights. They filled baseline surveys, and they got logbooks as well to fill. They captured 41 operations, and I followed them or observed them for 2 weeks. And during the 2 weeks, we took field notes, pictures, and even had questions for them during or between their operations. We filled thus post-operative questionnaires. After the observation period, we had interviews, semi-structured interviews with each of the surgeons. Results. We found that half of the surgeons ranked their overall light quality as poor or very poor. 7 out of 10 delayed or canceled operations due to poor lighting within the last year alone. And this is the setting of these hospitals are tertiary hospitals in the capital city. Headlight was found, however, useful in deep cavity operations, obstetrics, such as cesareans, and as a backup. In general, most of the surgeons use mobile phones as a backup light. So you have the attending surgeon operating, and for example, the resident taking out their mobile phone and using the light there to eliminate the surgical field for the surgeon, for the attending surgeon. The mobile phones were used also as an extra light to eliminate the field. So not only as a backup. We found 9 recommendations from the data. Among them, that the headlight should have increased brightness and comfort, increased battery runtime, be affordable, and have an additional or chargeable battery. So we analyzed the interviews and extracted 316 quotations from them. These quotations were then organized, and we noticed 4 major themes sticking out of these. So these 4 major themes that came out of the data are device and specification feedback, device improvement and considerations, existing hospital infrastructure, and factors influencing headlight use and utility. So we have 3 themes here that are related to the headlight itself, and 1 existing hospital infrastructure about the environment where the surgeon operates. Here we have an example quotation from the quality of data. Every time there is any electrical shortage, we have to call the generator people to manipulate the generator. That takes a lot of time to restart our surgeries. So, in conclusion, lighting in the surveyed operating rooms was poor and leads to cancellations, delays, and complications. Headlights, however, are useful for addressing the global surgical lighting gap, but they should be bright, durable, affordable, and have 2 rechargeable batteries. Future directions. So based on this feedback, an entirely new prototype was created. It was purpose-built with surgeons in mind to address issues within the more generic headlight. This new prototype is also a fraction of a cost of a commercially available medical surgical headlight. There is a lot of work to do to address the global surgical lighting gap, but perhaps this is a good first step. There is going to be a study to assess these new headlights very soon, hopefully. Thank you very much. If you have any questions or any information you want to know, please, you're more than welcome to contact me. Thanks.